Hi, it's Kim, aka the Tattoo Type 1, and this is going to be my first vlog about changing an OmniPod. And I've got all my supplies here. I'm getting them all ready because my PDM is about to go off to tell me to change my pod. It's going to do that in just a few minutes. These expire after 3 days, so what I'm going to be doing is, once it alerts me, is I'm going to remove this one and take a new one. This is the new one in the package from OmniPod. And I'm going to be putting this new one on my other arm. Now, you can put these on, I use my stomach, I use my legs. Go ahead and put them where, maybe where it's been a while since you put one there. I would go ahead and put one in a new area. If you don't remember where you've been putting them, check your arms, see if there's marks. This one's pretty good, so I'm going to be putting one here. I just know for a fact that before I put my pod here, I had one on my leg, and when I took it off, I had a bleeder. Basically what happened was, I took it off, it started bleeding everywhere. Never happened before. Had to use these bandages and gauze to get it to stop bleeding. It was really gross, scary, but it eventually stopped bleeding and I was fine. Pod, so it says it's telling me to hit the OK button, so I'm going to hit the OK button. And it brings me back to my status screen because all I've done is acknowledge the trouble. So at this point, what I'm going to do is I'm going to start to change my pod. And I know what to do. Sometimes I'll start to remove my my pod beforehand before I start to tell the PDM that I'm changing it. But what I do is I use this. The Insulet will tell you to use baby oil to use baby oil to remove your pods. I found just through experience that this works the absolute best. It's not putting a bunch of chemicals to dissolve the adhesive. I don't know if you can see. Yeah, you can see it. Where it's all white, there's adhesive that's holding the pod onto my arm. It hurts if you don't try to take it off. But in my experience, this is a baby oil gel. It works better, and it actually softens the skin. It helps to kind of take care of your skin, because diabetics are notorious for having bad skin. It helps to take care of your skin when you're removing the adhesive. It's pretty awesome, and it works really, really well. And all you're going to do is you're going to take a little bit of the gel, and you're going to start putting it on this white area that's holding the pod on there. So all I do is I apply it on there. I'm just smoothing it on. And as you smooth it on, you're going to see it's going to start to get a little translucent because the gel, the oil gel, is going to start seeping into that bandage adhesive, and it's going to start to remove the adhesive. And hopefully today I don't have a bleeder, so I'm not bleeding all over my very first video, which would kind of suck. Okay. So I'm gonna, and I kind of use, it seems like I'm applying a lot, but I've really just got a tiny bit on my finger. But I like to make sure that the entire bandage, adhesive bandage, is saturated. And I'll show, because it's really sinking in. Here we go. I don't know if you can tell the difference, but it's starting to get really translucent. You can see the spots where you need to go in. But I think I've got enough because it's starting to feel really weakened. All right. So I'm going to start telling my PDM that I'm changing my pod. So you go to, and the PDM will actually tell me that my pod's expired. It's telling me to change my pod. So what I'm going to do is you can't really change your pod from the status screen. You have to hit the home button. And the home button gives you several options, none of which tell you this is what you push to change your pod. So you have to go to more actions. And when you go to more actions, the very first thing says change pod. So I'm going to select that option. And it tells you to confirm that you want to change it. The PDM will always tell you, hey, are you sure you want to do this? There are multiple checks for it, just to make sure that you don't screw up, that it's very user-friendly. It doesn't want you to mess up. So what I'm going to do is I'm going to say confirm, and it says this will deactivate your current pod. So I'm confirming it. Then you're going to hear it beep. They both beeped. So when you hear the beeping, it says pod deactivated, remove and discard the pod, and then press next. So if you want to go in order, you don't have to take your pod off right now. It's dead. You can take your pod off later if you want to let the gel sink in some more, but I'm going to go ahead and remove it. If it wants to. There we go. Usually the easiest part about, it's just like ripping off a Band-Aid. Well, you don't ever want to rip off a Band-Aid because it hurts. You have to kind of find the little weak spot in the adhesive. You can see I found the weak spot. It's in this corner here. So it's really coming off easily. It doesn't hurt. So I'm taking it off. I'm just kind of working the adhesive off. And it's almost off, so I'm going to pull it. And yes, we do not have a bleeder. So you can see, looking good. My skin feels soft. It's not red. This is the old pod. I don't know if you can see. Yep, you can see it. That little blue straw that's sticking out, that's called a cannula. That's what actually sits in your skin and delivers the insulin. And this is the pod. You just throw these away. You can dispose of them, try to dispose of them the best way you can. I think maybe OmniPod has a way for you to recycle them or send them there. I haven't done that yet because I'm kind of a jerk, but someday. Okay, so what we're going to do is tell our PDM that we want a new pod because we want insulin. So back at the screen, it says remove and discard the pod, then press next. So we're going to hit next. And then my PDM is telling me that I don't have an active pod. It says, would you like to activate a pod now? Well, yes, I would. So we're going to say yes. Again, very user-friendly. It's telling me step by step exactly what to do. Fill a new pod with insulin. All right, that's the first step. This one's got a couple of steps here, and then it has a note, and we'll go over that. Fill a new pod with insulin. So, we got to get our new pod. It comes in this little container. I would suggest hanging on to this. It has a reference number on it. If something happens to your pod or it fails, they may ask you for this when you call Insulet to get a replacement pod. Go into that later. But I think the last time one failed, they asked me for the reference number that was on the actual pod. So if something happens to your pod, if it fails, don't throw away the pod. When you call Insulet, they're going to ask you for a number. I would keep both of these handy just in case, because you never know what they're going to ask for. So I'm going to hang on to that, set that aside, and I'm going to get, it comes with a little syringe. This is the syringe, this is the needle. You need the needle on the syringe, so you're going to just go ahead and twist it on there. I use the old plastic bits, and I kind of put all the stuff that I'm going to throw away in it. Okay. So we need some insulin, and I use Novolog insulin. It's a vial. I know I'm almost out, but I have another vial in the fridge waiting for me when I'm done. You need to sterilize everything. So what you're going to do is, I have my little prep pads. This is just an alcohol swab. Obviously got them at CVS. So I'm going to take my swab, and I'm going to clean off the top part of my insulin vial. Right? Swab, insulin, clean it. Now, if this were my new vial, I wouldn't have to clean the top because they are, obviously, they're sterilized. You just take the little top off and put your insulin in your syringe. All right. I usually do this on a hard surface, so I'm going to do them on my computer here. What you're going to do is take the top off. You'll see there's a needle. That's not going in me. That's going to go in the pod. I only do the minimum dosage because I don't need a lot of insulin. I've seen some people go up to 150 units in 3 days. I don't need that much. I think my basal dosage is like 9 units a day. I'm just really good about not needing that much insulin. So what you're going to do is you're going to put some air in the syringe, and you're going to tell it to, you're only going to put as much air that you need to however many units I'm going to give myself. So I'm just a little bit past the minimum line on here. I think the minimum for an OmniPod is 85 units. And there's always an air bubble. There's nothing that you can do about it. It's always going to be there. Don't worry, we'll get it out. Some people think that when the pod is priming that it gets the air out. It doesn't. It's priming the pump. It's a pump's prime. So I've got my insulin. It's in there. It's a very, very teeny bit. That's my insulin for 3 days. So I'm going to put my insulin back in my pouch. Now, it's really hard to see. Well, you can actually kind of see it. That bit at the top, that's air. We don't want that in there. So we're going to take that out. A lot of people, you'll see people do this, kind of feel like a drug addict. You're on drugs. You're a diabetic, you're on drugs. True story. We need drugs to live. It always blows me away that some people actually want to take drugs for fun. Why do you stick yourself for fun? It's not fun. But OmniPods and insulin pumps make our lives so much easier. Now I've got the bubble like pretty much reduced, so what I'm going to do is I'm just going to force it out with the plunger. Try to get the air out. And I do this really, really slowly because I don't like wasting insulin. Insulin is expensive. And it's a pain in the butt to replace. Okay. So what I'm going to do is I'm going to, there's a small hole right there. Oh, wrong side. Mirror. There's a small hole right there. That's where the insulin goes. There's a big arrow pointing to it. User friendly, can't screw it up. All right, so what I'm going to do is I'm going to take my pod and I'm going to inject my insulin into it, and I'm going to lift it up so you can see. Very, very slowly, it's telling me that it's got enough insulin. So I've got all my insulin in there. I'm just going to take my needle out. Done. We don't need this needle anymore. I'm going to put the cap back on and twist it. Safe. Good. Okay. So now that we know that we've got enough insulin, we're going to take our PDM and our pod, and they like to be close together. Also, the little note that's on here says, do not remove the needle cap at this time. The needle cap is this plastic bit right there. That's the one that's covering the needle that's eventually going to go into your skin. Don't take it off right now. So you click the next button, and what's going to happen is it's going to start priming your pump. And it clicks. So you're going to hear it click, and it's going to do like a little shooting noise, like a ch. There you go. That's one of them. It's priming the pump. It's getting it ready to deliver your insulin. And this really doesn't take very long. I know people that use other insulin pumps, their priming system or mechanism is a bit slower, takes a lot more time. The OmniPod really doesn't take very long. This is probably one of the longest amount of times it's taken me to change a pod, just because I'm doing this video, but it's priming. To prepare your infusion site, you take another handy dandy, super fancy alcohol prep pad, and you prep the area that you're going to be putting your pod on. I'm going to put it on this arm. Now, with tattoos, you're not supposed to put your pod over a tattoo. I don't have any tattoos right here, which is where I'm going to put it. Eventually, I will have tattoos there. I'm sacrificing this arm as a pod site to have tattoos. I know, priorities, but my life. What are you going to do? So right now, I'm prepping the site. I'm cleaning it off. with alcohol. And that's all done. We're going to let that air dry. Now, while it's drying, we're going to go ahead and remove the needle cap. The needle cap is right here, and it takes a little bit of force. You just kind of pop it off. And that's that. You discard it. Now, it's telling me to check to see if the cannula is sticking out, and it's not. I don't know. There you go. You can see it's not sticking out. It's completely flat. We don't want the cannula sticking out yet because we want the cannula when it comes out to be in our arm or wherever you're putting it. So, but it's not, so we're good. I'm going to hit the next button because I'm ready to go to the next step. Now it's telling me to remove the pod's adhesive backing. If the pod is wet or dirty or adhesive is folded, press discard. If everything's okay, apply to the site. So, you remove the backing. It's got two little tabs. You just take number 1 off and off with you number 2. Okay. And I can feel when alcohol is dried on my skin. You can feel it doesn't feel wet anymore. It just kind of tingles. So I know that it's ready. And I'm going to pop this sucker on. Try to be careful when you're putting it on. Make sure it's flat. Flatten out the adhesive, which is all good. It's all good. It's good and on here. Now here's the fun part. I'm going to tell this thing to stick me with a needle and insert the cannula. And it's really not scary. I don't really feel it. It doesn't bother me. Obviously needles don't bother me. But some people get kind of scared. Don't be scared. It ticks. I think my mom got really scared the first time she saw me do a pod change. She heard a very loud sticking noise. Yes, that's a needle going in my skin, but you know what? It doesn't hurt. So what I'm going to do is I'm going to tell it to go ahead and insert the needle and put the cannula in. So I'm going to click the next button, and then it tells you to hit start. See? It says hit start. So I'm going to hit start. It's going to start ticking, and then it's going to insert the needle, and then we're done. Literally, that's it. It starts basal delivery right away. So here we go. That was it. It doesn't hurt. You feel it. Everybody's like, oh, it's just a pinch. To me, it doesn't feel like anything really. It's a needle. It's one and done. It's in there. It's over. I don't have to keep sticking myself with a bunch of needles to manage my disease. That's the best part about insulin pumps, is that you don't have to worry about it. So it's telling me right now that my pod is active. It says my basal 1 has been programmed. Your basal delivery is basically just the steady stream of insulin that you get. I'm going to do another video on bolusing and how I do it. And bolusing is basically how we take care of ourselves when we want to eat. But right now it's already started to give me my normal steady stream of insulin. It's already been activated. So it's asking me if the cannula is properly inserted. So what I'm going to do is I'm going to check it as best I can. I have to look at it. There's a little pink slider that goes from the middle of the pod and towards the end of the pod towards where the cannula is. When that slides forward, you know that the cannula has moved forward. But you can also check, and it's really hard to check this way. But you're supposed to check to see if the cannula is inserted. You can see the blue straw. There's a little window right here. I'm going to check it later, but I'm pretty sure I'm okay. It's saying is cannula properly inserted. I'm going to check yes, and now I'm good to go. So that's a pod change. That's basically it. I'm going to load up my handy dandy Sugar Medical OmniPod carrying case with another pod for later, and some more alcohol swaps for my next pod change, but that's literally it. Thank you so much for watching.